The second biggest thing I do, which takes some training, is besides when I'm talking, I keep my mouth shut all day long. I keep my tongue on the palate and I breathe through my nose. Like it's called proper oral posture. Those are going to do more for you than any dental product there is. So if you're at your desk working and you catch your mouth hanging open and breathing out of your mouth, close that jaw, put the tongue on the palate, breathe through your nose. It's super important. We could spend an hour, 2 hours talking about this, but it's very important to proper oral posture, everything from like development to just overall health. So those two things are the main things. Now, I think to answer your question is more like, what are my routines around preventative care?
Well, we'll get there. I want to talk about the mouth breathing piece a bit before we get to that. Would you recommend for somebody who this is a new practice, whether it be at night when they're sleeping or if they're working at their desk, using tape to hold the lips together?
Yes, with caveat. So when I graduated dental school, I did a weird thing. I'm not sure this was ever even done before, but I had fallen down a rabbit hole of dental sleep medicine, which is treating obstructive sleep apnea with oral devices. So dentists can make these custom fit devices that'll hold the jaw in a position that opens up the airway to treat sleep apnea. And I learned how serious of a condition this sleep disordered breathing was, specifically sleep apnea, and how people are traditionally given a CPAP machine. They can't stand it. Over 50% of people diagnosed with it, that they're just going untreated, and dentists have this novel way to treat these patients. And I was just like enthralled. I was like, this is what I want to do. So after I graduated, I opened up a practice exclusively dedicated to treating sleep disordered breathing. And so I give all this kind of preamble because if you have sleep apnea, just taping your mouth shut, not gonna. It can definitely help. You want to be breathing through your nose, but it's not a treatment for sleep apnea. And so the one thing that gives me pause when people just mouth tape is sometimes, maybe more than sometimes, like often, there's an underlying problem, an airway obstruction that needs to be treated. Mouth tape is literally masking the problem. So that's what the caveat with the mouth tape. If you don't have an obstructive airway and your jaw is just falling open while you're sleeping and you need to train nasal breathing, fantastic. Highly recommend it.
Well, let's get to the root of the problem. For somebody that truly has sleep apnea, what's happening there? And you mentioned the problem with people in compliance of the CPAP, which is the typical way, at least the way I understand it, people would be treated for that. What would you recommend instead?
So the root of the problem, we'll start there, and we can talk about treatments. There's two causes to the root of this problem, and the first one is the development of the jaws, which we talked briefly about already, where our jaws aren't growing adequately, and that's why we have malocclusion today. Our mouths are too small, so teeth are just erupting wherever they can fit. Well, that's because our jaws aren't growing adequately. But if your jaws aren't growing adequately, they're too small, right? Well, we have this muscle in the mouth that does not shrink with it. In fact, when you're gaining weight and getting obese, it will deposit fat there, and that's your tongue. So you have this, I call it a shrinking cage and a growing prisoner. And so that prisoner has only two escape routes, and it can go forward, like you stick your tongue out to get that tongue out of the airway. And we just talked about, like, you don't want to be breathing through your mouth, and you don't want to have an open oral posture. So the other escape route is backwards. So the tongue will fall backwards and it'll obstruct the airway. And so that's why the oral appliances that a dentist will make will be used to treat this. And it's kind of like, if you've ever been taught CPR, they'll tell you to lift the chin to open the airway. Well, these oral appliances will position the bottom jaw, in a forward position that helps open the airway. Now, the tongue can still fall back, so it's not a foolproof treatment, but it's a good option for people that, especially those that cannot tolerate CPAP machine. The CPAP machine, for anyone that's known, it's like a mask, and basically it just pumps air down your throat. It's a pneumatic splinting of the airway. It forces your airway open. And that will more or less work because they will just crank that pressure up to as high as it has to go to open up the airway. But as you can imagine, it's not well tolerated or desired by most people. I can tell you from my experience, when I was treating patients, they fell in two camps. One is they're already given up on CPAP, and the other one is like, they use it, but they hate it, and they really want to try something else. Now, obviously, I probably had to buy a sample because that's what I was doing. I was seeing patients for this treatment. But that's the root cause, and the two standard treatments now are PAP. Now there's auto PAP, CPAP, EPAP, and oral appliances.
Okay, it sounds like both of those may not be perfect solutions. Is there something else that you'd recommend, or would you lean towards one of those?
Well, so part of it is if it's a weight problem, like losing weight, very beneficial. Positional therapy, where it's like you're sleeping on your side. If you can imagine gravity, if you're on your back, gravity's working against you. The tongue's falling back, the jaw's falling back. So sleeping on your side, positional therapy, losing weight. But a lot of it is also structural. So you can get a surgery called MMA, maxillomandibular advancement, where the oral surgeon will basically move your jaws. Kind of like if you imagine like you had actual full proper jaw development, they're going to force that. They break your jaw and they move both of them forward, and that'll create more space in the back of your throat. Uh, but beyond surgeries, weight loss, positional therapy, um, various kind of PAP, CPAP, APAP, AutoPAP, which APAP's AutoPAP, EPAP, which we can talk more about. That's the device I developed as an EPAP device. Uh, Oral devices. There's tongue retaining devices. So a tongue retaining device, if you imagine a pacifier and you stick your tongue into it, it's literally like just pulling your tongue out of your throat. And those are pretty effective, but as you can imagine, no one wants like very, very bad compliance with those. So those are kind of the options when it comes to, sleep apnea.
So, weight loss first. If you get your weight to a good place and you're assuming your tongue isn't fat at that point, then you can turn to what you just suggested. You also mentioned your device, Ned. Talk more about that and how it works.
Sure. And what one quick note is sometimes weight loss is not always first. And what I mean by that is one of the most gratifying things treating sleep disorder breathing, sleep apnea, is you treat a patient and like their life changes almost overnight. And that's because sleep apnea is the airway shutting down at night. And then that's what apnea means, cessation of breath. And then it's 30 times in more an hour is severe apnea. So it'll do that 30 times an hour. And every time it closes down, the body doesn't want to die. So it basically injects itself with like an adrenaline shot to wake itself up. And so you don't necessarily consciously wake up, but the stress response gets the body to open the airway and then it closes down and open the airway. All this to say is you haven't slept a good night's sleep often 5 to 10 years before someone gets a diagnosis of sleep apnea. And so weight loss is very difficult if you haven't slept for, a week, nonetheless, a decade. So sometimes getting the sleep right is the path to fat loss. And so yes, as you mentioned, I developed a device. So I'm treating patients and these oral devices, basically I'm seeing people that are CPAP intolerant. They can't stand it. And so I'm treating them with oral devices. And if you move the jaw slightly forward, it stabilizes the jaw position so it doesn't fall back. And the patient's comfortable. And it does a decent job at treating sleep apnea. And it often decreases the severity in half. So you take someone from 30 events an hour to 15. And that's good. But to me, someone having 15 events an hour is still just like, they're not, like, it's not good. And it never sat well with me. So I was like, what else can I do? And so I did research and I came up with this idea for a nasal EPAP dilator. And basically what it is it's a nasal dilator. So it's crucial. Like you have to breathe through your nose, or you're not going to have success. So that's why it's a nasal dilator. It's going to make it easy for anyone to breathe through their nose, even if they have like constrictions or deviated septum or anything like that. So you can breathe through your nose, and it has an EPAP valve on it. And EPAP stands for expiratory positive air pressure. But it's basically when you breathe out, it slows your exhalation, creating kind of a back pressure that keeps your airway from collapsing. And so my idea was, I'm like, all right, I'm treating patients with this oral device, and we're just getting them to this comfortable position. Sometimes they'll be like, oh, you didn't treat sleep apnea. You move the jaw more forward. You can only move the jaw so far forward, and then you start getting all kinds of problems. So like pain, TMJ problems. So the idea was, hey, you just move the jaw a little bit forward, then you use this to augment the results. And so I got the patent on that, which was very exciting. And the product is actually officially launching in about 6 months, so Q1 next year. But it's not going to be for sleep apnea, just for snoring. So that's the caveat, because we're not getting FDA cleared for sleep apnea. That requires more money and time than I have. So, so the indication is just going to be for snoring, but that's basically how it works.
And from the way you explained it there, this is addressing the nose. And if somebody is getting a classic type treatment with the jaw being moved forward, this has been a missing piece. Although you can't say it's you have to say it's for snoring and not sleep apnea. From reading between the lines, this is helping out with sleep apnea, a missing hole that hasn't been addressed till now.
Yes. So there was an EPAP product called Provent that was the first EPAP product on the market. It's relatively new invention, like 20 years ago, let's say. In the realm of medicine, that's pretty new. And it was an EPAP product that was FDA cleared for sleep apnea treatment. And they went bankrupt for a number of different reasons. And there's really been like a hole in the EPAP market. Now there is another product that is FDA approved for sleep apnea, but there's basically no EPAP product for snoring. And so that's the indication we're going after. And my original thought was like, hey, you use this in combination with this oral device. And as we tested this product, it works fantastic, like on its own without an oral device for snoring. And so it makes perfect sense to kind of go to market for that. And if a doctor is going to prescribe it off label, that's their prerogative.
And what's the connection between sleep apnea and snoring? And why I want to go here is somebody who is waking up feeling unrested. If their partner's saying they're snoring, how do they begin to piece this together and realize they have a problem?
So there's a technical definition, but it's generally on a continuum. You have upper airway resistance syndrome, which is basically snoring on this side, where the airway's narrowing, but your airflow's still going through. You're not like not breathing, which apnea is a cessation of breath. Like the airflow stops. So with snoring, you hear the noise because there is airflow. When you hear that airflow stop, and then you'll often hear like a gasp for air, that's an apnea. So if your partner does that, it's very common. So people listening to this, there will be many people who are like, oh yeah, that's exactly it. They're snoring and then it stops and then there's a gasp. That's apnea. So it's really a continuum. Snoring, upper airway resistance syndrome, air still going through. There's forms of mild apnea where you have hypopneas, which is not a full apnea, but airflow is restricted such to the degree that the oxygen in your blood drops by 4% or more. So if you're breathing so difficult that it's causing your oxygen to really kind of plummet, they count that as a hypopnea. And so that's more of your mild forms of apnea. And then once you get to more severe, you're getting full apneas. That's cessation of breath, generally for 10 seconds. Also causes 4% or more decrease in oxygen saturation. And so this is an AHI index, apnea hypopnea index, where if you are 30 or more, you're severe, 15 to 30 is moderate, 5 to 15 is mild. And a huge amount of people are like in this mild range. And like my device, not FDA cleared for sleep apnea. But the problem I see is a lot of people need like they have mild apnea. You want to treat that, but like a CPAP is like a bazooka for that, right? So you got this whole big machine and you got mild apnea. Oral appliances can be a great option for those people, but they're not. You have to be a right candidate for an oral appliance. You have to have healthy teeth. You have to not have TMJ issues, like no periodontal disease. We talked about 50% of people have periodontal disease. So like that's already kind of getting rid of half the population, and they're not well covered by insurance. So they can be very expensive. And so it's like, hey, what's a low cost option for this massive population of people with mild forms of sleep disordered breathing? And so that's kind of what the niche I hope my product fits.
Somebody right now who is suffering from snoring, either themselves, their partner, both of them, likely the latter. Until your product comes to market, is there anything else people can use, like those nasal strips, anything out there before your device hits market that people can try?
Well, kind of things that we've talked about, that like nasal breathing is like job number one. So if you're going to use an oral device, you're going to use my device, you need to be breathing through your nose. So my device is a nasal dilator, so it's going to help you facilitate nasal breathing. But if you put a nasal strip on and you start breathing through your nose, that's a fantastic start. Mouth tape to help facilitate that as well. That's a great starting place. We mentioned some of the other stuff is positional therapy, where you sleep on your side, and there's different kinds of products. Like the classic positional therapy device was you sew a tennis ball into the back of a t-shirt and you go to bed with that. So anytime you roll over onto your back, like you don't, right? It'll wake you up and get you back onto your side. There's other more elegant ones that aren't so, that won't wake you up so drastically. But I also always recommend people, like, if you can, get a sleep study. They can be done at home. You don't have to go into a lab, PSG, where they hook you up to all those wires and sleep in a foreign environment. They still do that, but now they do more and more home sleep tests. So you can sleep in your own bed. I just think it's important because it's like sleep disordered breathing is perhaps the most serious, undiagnosed, untreated medical condition in the Western world. Like, it is so prevalent, and its effect on quality of life and how it exacerbates basically all comorbidities, super important area. So I do recommend sleep tests, even though I know a lot of people are hesitant to do those. They can be pricey, and if you work for the DOT, if you get a sleep test and you test positive, well, then you have to like be using your CPAP machine, clocking in. So obviously, it's important because people with sleep apnea are prone to, if it's untreated, you're prone to accidents like falling asleep at the wheel.
How do you feel about some of these consumer devices like the Aura Ring and using that to determine some of what we're talking about today if somebody is snoring or has sleep apnea?
I think the future, like I think it is the future. Uh, so that's the caveat, meaning like I think the data up to this point historically has been very suspect, and sometimes I think it does more harm than good. Some of these things where someone looks at their tracker and they're like, oh, I only slept 4 hours last night, I have to be tired today. So it kind of like psychologically like a negative, but I think it brings awareness to sleep health, which, like I was just mentioning, is so important. I don't, probably not enough attention put on sleep health. I saw just this week Apple's new watch got approved for now it can't diagnose sleep apnea, but it got approved for basically saying, yes, you are high risk for sleep apnea, which I think is a huge, like, that's what it should do. Like, it said, hey, we noticed like your blood oxygen, like, because some of these can also do pulse oximetry, which is basically monitoring how much oxygen in the blood. So if they're doing snoring, they're like, oh, we heard you stop snoring, and then we saw your heart rate spike, which happens after an apnea to get you to wake up, and we saw your pulse oximetry drop. Like, that's all the data you need to be like, that's high risk. That was probably an apnea. So we got a lot of this technology, which will probably be a boom for the sleeping industry. Everyone will realize, like, oh my God, none of us are sleeping very well. So I think it's good to bring awareness, but also cautious about some of the technology up to this point. I found it to be, so.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We take those 300,000 years, we put them on a 24-hour clock. The first 23 hours, we don't see cavities in the fossil record. We don't see periodontal disease in the fossil record. We don't see malocclusion in the fossil record. We don't really see abscesses in the fossil record. But something happens 1 hour ago.